Okay, so as Andrea stated, I'm Dr. Liam Sullivan, one of the adult infectious disease doctors here at Spectrum Health. And so here's a quick update on the COVID-19 hospitalizations as of August 25th, so as of today across the Spectrum Health system. As you can see, we have a total of 112 hospitalized, 92 of which are unvaccinated, 20 that are vaccinated. 31 of the total COVID-19 patients are in the ICU, with 6 vaccinated and 25 unvaccinated. And we have 20 of those patients on ventilators, and 4 of those are vaccinated and 16 are unvaccinated. Now, you might look at this and say, wow, we have a lot of vaccinated patients in the hospital. Well, I think people need to understand that there are various reasons why people who are vaccinated might still end up in the hospital. And the primary reason for that is not everybody has an appropriate response to vaccines. We have a huge population of people that are immunocompromised, whether it be from an underlying disease condition or medications that they take for other conditions. So their response to vaccination is not the same as a person who doesn't have those underlying conditions or medications would be. So thus, they're going to be at increased risk for potential severe disease from COVID-19 infection. And I can say from personal experience, I have taken care of several patients who have been vaccinated that are in the hospital. And the primary reason why they've gotten sick is because of an underlying immunodeficiency or the medications that they're taking, thus them not having a very good response to the vaccination. So, and then the other thing to remember too about these vaccinated patients is a lot of them are incidental discoveries, especially amongst the 20 vaccinated patients. And by that, I mean a lot of patients get admitted to the hospital for other reasons, and we screen everybody admitted to the hospital for COVID-19. And we incidentally discovered vaccinated patients who are positive, but they are completely asymptomatic from a COVID-19 standpoint. For example, people may get admitted for trauma, they got a broken leg or et cetera, and then they get a screening spot for COVID-19 and it's positive, but they're not having fevers, not having any respiratory symptoms at all. So they're completely asymptomatic. And I would say about half of our vaccinated patients fit into that category. So there are more to the numbers there than meets the eye. So I think it's very important not to get too alarmed by the fact that we have 20 vaccinated patients in the hospital, because there are some very good reasons for it when you really start looking at those numbers more closely. Next slide, please. And then you can see as far as inpatient COVID-19 deaths since vaccines became available, we've had a total of 212 deaths, of which the vast majority of them, as you can see, are in unvaccinated patients. Well over 90% of them are unvaccinated patients, and about 8.5% of them are in vaccinated patients. Again, I want to caution you that these fully vaccinated patients who have died, there's various reasons that they may have died because of an incomplete response to the vaccines due to immunodeficiency, medications, et cetera, and people incidentally testing positive when they were not admitted for COVID-19 in the first place. So I think this graphic really shows that vaccines are definitely saving lives and have been overwhelmingly successful since they have become available.
Thank you, Dr. Sullivan. Dr. Olivero, do you want to give an overview about what you're seeing at Helen DeVos Children's Hospital?
Yes, I am happy to. So over the past 3 to 4 weeks, we have had anywhere between 3 and 5 children admitted to the Children's Hospital who are COVID positive. So not a huge jump in terms of numbers. And actually today we have 2 patients, pediatric patients who are admitted to the hospital who are COVID-19 positive. But a very important note is that those 2 patients are requiring care in our intensive care unit. So we do want to highlight the fact that having children hospitalized with COVID-19 remains not terribly frequent. However, the occasional child will need very high levels of support because of their COVID-19. And then in the past week, we have also had 1 diagnosis of the multisystem inflammatory disease in children. And that child was diagnosed last week and was treated and was released from the hospital yesterday. Thank you.
Thank you, Dr. Olivero. Let's start opening it up to questions. Please post your questions in the chat and we will go ahead and do that. Dr. Sullivan, do you want to talk a little bit about breakthrough cases?
Yeah, so, the breakthrough cases, as I sort of alluded to before, when patients get a breakthrough infection, really what we're referring to is they're fully vaccinated and they test positive for COVID-19, and they actually have symptoms for COVID-19 as well. And, the major reason, as I stated before, that we see breakthrough cases is there's a couple of things. Number one, the most common reason by far is patients don't have as good a response to the vaccine as normal because of an underlying medical condition, be it medications they're taking or an immunodeficiency, and therefore they don't respond to the vaccine quite as well as normal people do. You know, and some people, age is also another thing that we see, because as we age, our immune systems don't work as well as we age, and our response to vaccines does not last as long as we age. And so what we see sometimes is people who are elderly, you know, over the age of 65 primarily, you know, that got vaccinated 6, 8, 9 months ago, you know, today they may not have as much immunity today as they did back then, and therefore they're getting a few more breakthrough infections, et cetera. And then, you know, then we see, as I stated before, the asymptomatic breakthroughs where patients don't have any symptoms at all, and they probably got exposed, got infected, but they're not showing any symptoms because their immune system has the infection already under control. So those are the major reasons we see breakthrough infections.
Thank you. Dr. Olivero, one question, just to confirm, the 2 pediatric patients admitted today with COVID were admitted to the ICU because of COVID, not because of something else, correct? Could you confirm, please?
Yep, so the 2 patients in the ICU have symptomatic disease from COVID-19. One is a more complicated case and had a more rare manifestation of COVID-19, but the other is a very typical severe acute respiratory COVID-19 infection.
Wonderful, thank you. Next question, what is the hospital expecting as we enter the fall and winter as far as COVID hospitalizations? And are we doing anything to prepare? So I'm not sure if you guys want to both take that from your appropriate perspectives and go forward with that. Rosie, you want to start?
Sure. Yeah, absolutely. So I think that the pandemic has certainly told us that predictions are very, very challenging because there are so many different moving parts with the pandemic, ranging from vaccination to the various different mitigation strategies that are used in a variety of different settings, to public spaces, gyms, restaurants, and schools as well, and universities. So there are so many different things that are factoring into that. And even as recent as this past week, we now have the FDA approval for COVID-19 mRNA vaccines. So that was an absolutely huge step. And I'm sorry, let me just edit that. We have the FDA approval for the Pfizer vaccine, one of the mRNA vaccines. So that will certainly shift the number of individuals who are vaccinated. So there are many different things factoring into that. I think that given what we are seeing in the southern states with the massive surge of the Delta variant, we are seeing that our unvaccinated populations are becoming dramatically infected by COVID-19 far more than our unvaccinated individuals. And so we do have concern that as many children have started school within the past week, and there is variable mandates for mitigation strategies for COVID-19 in the schooling environments, that we could see, especially our unvaccinated young children less than 12 years of age, we could see far more cases of COVID-19. And if we have a large body of individuals who are admitted or who are infected with COVID-19, there is going to be a certain percentage of them that do need to come into the hospital for medical care related to their COVID-19. So from the Children's Hospital perspective, we have a high census to begin with. And then if we have a large number of individuals who become COVID positive, we could see quite a dramatic increase in COVID-19 admissions in the hospital this fall and winter, but can't really put a good timestamp on that because of all of the different factors that I mentioned.
Thank you, Dr. Olivero. Dr. Sullivan, do you want to add some perspective to that from the adult viewpoint?
Yeah, I would like to, I would echo what Dr. Olivero just said there about all the moving parts and various mitigation strategies, making prediction of what's going to happen very difficult. I think suffice to say it's probably likely we're going to see an increase in cases. What that means for hospitalizations remains to be seen. Obviously, we're concerned about it and watching it very closely. And I mean, if you look at our hospital numbers now, let's go back 7 weeks back to the beginning of July. We were in like the mid-20s and had been in the mid-20s for a little while, and then slowly started to creep up. And really in the last 4 weeks have had a much more steep rise in hospitalizations and in percent positive of tests in our community. We were averaging about 2.5% positive tests back in early July. Now we're up to almost 10% average 7-day positivity. So clearly the circulation of the virus is dramatically increased in the community, and that's almost certainly due to the Delta variant. I mean, look at what happened in the southern United States and the explosion of cases and hospitalizations down there. And now that's beginning to creep up into the northern states as well. Now, what that means going forward for us in the adult world is a good question. I'm sure we're going to still see more hospitalizations. The question is it going to level off? Is it going to peak? Is it going to be a steep rise, a slow rise? that is anybody's guess at this point in time for all the factors that Dr. Olivero said. I mean, if COVID-19 has taught us anything, it's that predictions don't work very well. This virus does what this virus wants to do, and it's going to continue to do that for the foreseeable future. So we're getting ready for the worst and hoping for the best.
Thank you. Dr. Olivero, a question from MLive. What is the age range of the children admitted to the hospital? I'm not sure we can comment on that due to identifiers. Correct me if I'm wrong.
I am actually not sure if we usually are able to give a range. Now there are only 2 patients, so I think, I think commenting on their age is maybe not a great idea.
No problem. We can skip that question. Sorry, John. Next question. How are you preparing for booster shots as well as third doses? What is the guidance on booster shots for patients? Who would like to take that question?
So I can take that since it's obviously primarily for adults at this point. I mean, we're already telling all of our immunocompromised patients to get booster shots because the ACIP, which is the Advisory Council on Immunization Practices, and FDA have authorized booster shots for that group of people. So it's very easy for them to get it. They can just go to any pharmacy or through Spectrum Health, attest that they're immunocompromised, and then they can get their third shot if they so desire. So we're strongly encouraging all of our immunocompromised patients to do that. As far as the rest of the group of people who have been vaccinated and are potentially getting booster shots, we're sort of waiting for more information. ACIP and FDA have to speak on that as well. So far, the announcement has just come through the Biden administration, but they did say that FDA and ACIP are going to make further recommendations on it. And I think ACIP is probably waiting for more information from Johnson & Johnson because I don't think they want to leave people who've got a Johnson & Johnson vaccine hanging. And actually some data just came out today about Johnson & Johnson that showed that getting a booster shot for Johnson & Johnson was very beneficial. So I think what you're going to see is probably within the next couple of weeks here, ACIP meeting, and then they will give recommendations and guidance for how we should go ahead and start with booster shots and what if there's going to be any priority for people with regards to age, work status, et cetera. So I think a little bit more information to come, but we're definitely starting to get ready for it, but we just have to wait a little bit longer before we know exactly what to do.
Thanks, Dr. Sullivan. How does this rise in cases compare to past surges of COVID-19?
Good question. I mean, last fall, we go back a year ago, we were in pretty good shape at this time of year last year. And then really in September, we started to see a really steep increase at the end of September and early October last year. And then it just sort of took off like this and went up and peaked sometime, not until like about mid-November, mid to late November, and then very slowly came down over the next month and a half to 2 months. And then we were doing okay, and then had another sharp rise, and starting in about mid-March, that peaked sometime in April, and then started coming down again. So, right now the rise in the curve is hard to say. It somewhat looks a little bit similar to the past ones, although maybe not quite as steep at this point in time. Hard to say yet. I think we need a little bit more time before we have a much better idea of where this might be going. It's a little hard to say at this point in time.
Thank you. Dr. Olivero, do you have anything to add to that?
Yeah, I think I will just add that I totally echo with what Dr. Sullivan mentioned. I just saw a statistic this morning that in the past week, the number of COVID-19 cases in the state of Michigan has increased 37%. So it's a pretty large increase. And obviously, the more people who are infected at a time, we expect that the numbers week after week will go up at a higher percentage or a higher rate of rise.
Thank you. Dr. Olivero, this question is for you. Children with multi-system inflammatory disease get seriously ill, but most recover, correct? Do these patients tend to have long-term effects?
Yeah, that's a great question. I did post some comments there in the chat as well, in case I'm not clear when I speak about it. But yes, the medical care for multisystem inflammatory syndrome is very intensive. A fair portion, around a third to a half of patients, do require some care in the intensive care unit. So that's obviously pretty high level of support that the children need. Of the patients that we have had with MIS-C over the course of the pandemic, we have had one death. We've had one patient who suffered multiple amputations because of MIS-C, and we have had a few children who have also had strokes because of MIS-C. So those all obviously have very important long-term effects. However, the organ that is the most severely affected by MIS-C is the heart. And the children have recovered enough to leave the hospital, but they do require long-term cardiology follow-up. And we do not know yet what the long-term effects on the heart for these children will be. We don't know if they will have increased risk of not being able to exercise due to risk of heart attacks and other things like that. So a lot is yet to be known, but of course we do have a high level of concern given the degree of inflammatory effects that MIS-C causes on the pediatric heart.
Thank you, Dr. Oliveira. One more question for you. What were the peak numbers of child COVID-19 hospitalizations at Helen DeVos during past surges? Do you happen to have that number?
Yep. I put that in the chat as well. So there were our peak, we had 18 children in the hospital with COVID-19, 5 of which were requiring care in the intensive care unit. And that was in the spring of 2021.
Thank you. Let's see, Dr. Sullivan, this is for you. How would you describe current adult COVID cases admitted to the hospital? Significant, a large increase, slight increase, etc.?
There's definitely been a significant increase over the last 4 weeks. There's no ifs, ands, or buts about that. I mean, we have had, gone from a COVID census in the 20s, now we're over 100 system-wide. And so there's been a pretty steep increase in COVID-19 cases in the last several weeks. And probably one of the biggest differences between this surge and previous surges is they're younger patients, unfortunately, and obviously largely unvaccinated as well. So those are the two, those are two things that really stand out about this surge at this time.
Thank you. Robin, I see your questions about the vaccination efforts going on among Spectrum staff.
Those are two things that really stand out about this surge at this time.
And I will follow up with you on that. Our infectious disease experts aren't going to know those stats offhand. So we'll jump to the next question. What is it like to think back to the original flatten the curve attempt early on in the pandemic? Learning what we know now, how could it have worked? What is to know that there are many curves after that? What have hospital staff learned over the past year and a half? Dr. Sullivan, do you want to take a stab at that one first?
Oh, that's a really good question. It's pretty amazing when you think back. I mean, we've been going at this now for 18 months, I guess it would be. And I think back on it, and I can just remember the uncertainty, the anxiety, the lack of good information. We didn't know what we were dealing with. We all felt like a tidal wave was about to hit us, et cetera. I mean, it's just amazing when you think back and look back on how much we didn't know back then, compared to what we know now. And actually, there's still a lot we don't know. We got some things right. We got some things wrong along the way. And that's science. I mean, if you look at science, it's always changing, and it's always being updated because we find out some of the things we did weren't the right thing to do, and because later research shows that there's a better way to do things. So, and I think this pandemic has really shown that through. And unfortunately, it's been, getting information during this pandemic has like been drinking from a fire hose. It's coming at us from all different directions and all different times. And numerous sources, making it very difficult to tease out, well, what's accurate, what's good, what's not good, et cetera. So I think we've definitely found some things that work. I mean, I think in the hospital, what we found that we can take care of patients who are severely ill with good old standard medical care, like anybody with respiratory failure. That doesn't mean they don't get sick and don't die, because unfortunately they do, but we've learned how to take care of them and try to maximize our ability to get them through their illness. We found a couple of therapies that help marginally, like dexamethasone works marginally well. It certainly is helpful. Remdesivir sometimes works, sometimes doesn't work so well. Really depends on when the patient gets admitted to the hospital, how good it's going to work, et cetera. But, I think still we lack really, really good effective therapies for patients when they get COVID-19. When they get into the hospital and they're requiring a lot of oxygen, we really are lacking therapy. Monoclonal antibody therapy works really well for people early in illness. So if you can get them as outpatients or immediately when they get to the hospital and they're not requiring any oxygen, the monoclonal antibody therapy works very well. But as soon as they start having increasing needs for oxygen and develop respiratory therapy, monoclonal antibody therapy doesn't work well at that. We learned convalescent plasma therapy doesn't really work for patients. So, we've tried a lot of things and a lot of things haven't worked. And we've figured out some old things that work a little bit that help us out. But there's certainly much more to learn going forward. And hopefully we have better therapies on the horizon in the coming, months with COVID-19.
And could I add a comment to that as well? just a little additional perspective. I totally agree with what Dr. Sullivan said. I think, along the theme of learning and learning lessons from the pandemic and all the things that have happened because of our efforts to flatten the curve, et cetera. The few byproducts that we saw of all the efforts at trying to prevent COVID-19 surges and overwhelming the healthcare environments, some of those came with mitigation strategies that were extremely helpful at preventing other things from happening. In my career as an infectious disease physician, I've never seen a year where I didn't take care of an influenza patient. And I never had a year where I didn't take care of hundreds of patients with RSV associated bronchiolitis. And those things were really did not come onto the scene this past year, which actually prevented a lot of death and disability in our pediatric population. That wasn't necessarily the target at that time, but that was a byproduct that was incredibly important. And as we think about this year, every respiratory virus that a child or an adult gets infected with causes testing, leaving work and school can cause quite a bit of disruption. So I think there are some byproducts of the mitigation strategies from this past year that were incredibly powerful. And then the last thing I'll mention is that in terms of the hospital capacity, I think we are learning some real-time lessons from our southern states who in the children's health world are really beyond their capacity to care for not just COVID-19, but other things that can happen to a child, like getting into a severe car accident. And the access to intensive care units is very, very stretched thin in those places. And we certainly do not want to get to that point for adults or children in West Michigan.
Thank you so much for answering those questions and for that perspective. Dr. Sullivan, are you experiencing a higher or lower percentage of breakthrough cases than you would have expected?
I don't think it's any higher than I would have expected. I think it's kind of like right where we would have expected them to be. You need to remember, so as the proportion of people that are vaccinated increases, you're going to see more breakthrough cases. That's just the law of numbers. And right now, the proportion of people vaccinated, for instance, right now compared to proportion of people fully vaccinated back in April, for instance, in the state of Michigan is much higher. I think right now in the state of Michigan, I think we're somewhere in the mid 60s with at least one dose of vaccination, and we're over 50% fully vaccinated. Whereas back in April, the numbers were about half of that. So it just stands to reason by sheer numbers alone that as the proportion of vaccinated people increases, you're going to see some more breakthrough infections. And we knew that the vaccines were not going to be 100% successful at preventing all infections, that at some point we were going to start to see some more breakthrough infections. And so it is not at all surprising that we're seeing them, or the degree that we're seeing them. And then the other thing I had is that Delta has been a game changer. The Delta variant is an evolutionary creation by this virus in its desire to circulate amongst the human population in a more efficient manner to keep infecting hosts. The COVID or SARS-CoV-2, the virus that causes COVID-19, has learned how to attach onto cells inside the human body much, much tighter than previous versions of it, and also allowing it to replicate at a much, much higher rate inside of the nasal and the respiratory tract, thus increasing the amount of virus that people expel when they're infected and increasing the risk for infecting those people around them. So Delta is really been a game changer. And with the Delta variant, it is not at all surprising that we're seeing more breakthrough infections just because of some of the evolution of this virus.
Thank you, Dr. Sullivan. Let's start with you with this next question. What advice do you have for those who are not vaccinated?
My number one advice is to get vaccinated. There's no single thing that is going to protect you more from getting COVID-19 than getting vaccinated. And you may think you are very healthy, you may be young, you may be in great shape and take great care of yourself. That does not mean you can't get severe COVID-19 infection. True, you are at much less risk than other people would be. That being said, we have seen numerous healthy young people who have taken great care of themselves get severe COVID-19 infection. And there's just no way to know for sure that you are 100% protected from developing severe infection. When you get vaccinated, that astronomically decreases everyone's risk of getting hospitalized and getting severe COVID-19 infection. So that is the number one thing you can do, is get vaccinated. And if you're uncertain about vaccines and still nervous about it, I really would encourage you to talk to your personal physician about it. Have a good, frank conversation with them about the risks, the benefits, the side effects, et cetera, And you know, because that person is probably in the best position to give you really good, straightforward answers because you've established a relationship with them.
Thank you, Dr. Sullivan. Dr. Olivero, do you have anything to add to that?
Yeah, I totally agree with Dr. Sullivan. I think that that is going to be the way to protect yourself and others with the least amount of disruption to your life. I think that many of us who are vaccinated are also taking additional strategies at this point in time because, you know, there's a lot of uncertainties, and we're obviously seeing a very sharp rise in the increase in cases, and we are really looking out for our community. So certainly there has been the recommendation in indoor environments for unvaccinated folks to adhere to mask mandates when in public spaces. And there's obviously no way to double check that when you're going into a grocery store, but we still continue to recommend that when you're going into an indoor space, unvaccinated folks do that. And even I would say as a vaccinated person, I'm doing that as well. Avoiding those large gatherings where you can't practice social distancing, hand hygiene, all of those basic things that we learned from the pandemic to be helpful. I would continue to iterate the need for those things to be in place.
Thank you so much. We have 2 more questions. We'll try and wrap those up quickly in the time that we have. Let's see, Dr. Olivero, this one's for you. You obviously heard about groups of parents going to county boards, school boards to complain about mask mandates for students. What is your view of this or your recommendation?
I'm sorry, you're speaking to just the act of people going to the board meetings or just for the upholding of the mask mandates?
I assume it's of the mask mandate.
Okay, so the benefit of having a universal mask mandate in schooling environments is because really the way to prevent a COVID-19 outbreak in a crowded indoor setting like a classroom is for everyone to be masked. Because we know there are some benefits to the person who's wearing the mask in terms of reducing the likelihood of them inhaling COVID-19 and getting infected. But really the virtue comes in protecting everybody around you in case you are coming into a room harboring COVID-19, and that mask will catch the vast majority of those respiratory droplets and make it much less likely to spread COVID-19 throughout the classroom. So when we're thinking about this extremely contagious Delta variant that can actually probably travel farther than 6 feet and infect people, that is incredibly, incredibly important, especially when you're talking about our less than 12-year-olds who are completely unvaccinated. So that's really the rationale for the American Academy of Pediatrics and the CDC for recommending universal mask mandates for K-2 through 12 schooling environments. It's not just for individual protection, it's for protection for the whole classroom. And if left to individual choice on whether or not to wear a mask in the classroom, you may be able to protect yourself some by wearing your mask yourself, but really the benefit comes if you can have all of these folks who could have asymptomatic shedding of the virus and protecting everybody in that indoor setting.
Thank you very much. A very last question, looks like it's for both of you. You mentioned that some of the patients are hospitalized for other reasons, trauma, but test positive for COVID. What does research say, or do we have good data yet on whether or not vaccinated people are more likely to be asymptomatic?
That's a good question. I think that is just starting to be looked at, or not looked at, we're just starting to get some answers on that, and research is starting to come out about that. What we do know so far is that the vast majority of vaccinated people who get COVID-19 are either asymptomatic, or when they do have symptoms, they're very mild. They get a bad cold and they get over their symptoms in a few days, and they don't develop severe respiratory distress and COVID-19 pneumonia warranting admission to the hospital. So the vast majority of vaccinated COVID-19 patients do not develop severe illness or remain asymptomatic. So that's good. There's still more to come on that. I think one of the most alarming things about this, though, or not alarming, but one of the most concerning things I should say, is that with Delta shows this ability when it does cause breakthrough infections in vaccinated patients, that it is able to replicate to amounts just as high in an unvaccinated person as a vaccinated person. So what I'm saying is that, so you're vaccinated, you get infected with the Delta variant, the amount of virus that is replicating in your respiratory system is just as high as it would be as if you were unvaccinated. The question right now is, how long are vaccinated people shedding virus, and how long are they contagious to those around them? That's something we don't have the answer to yet. And I think in the next few months, we'll probably have a much better idea, because there's a lot of research going on around that to see, okay, how long do vaccinated people shed virus when they are infected? Because, you know, they are developing an immune response to the virus, but one of the big things that vaccines do is when they're injectable vaccines, like an intramuscular injection for the current vaccines, is they develop a systemic immune response. They don't do a great job at developing an immune response right in our nasal passages or in our respiratory tract, right at the doorstep, so to speak. The virus is able to get inside the door, but and the immune system ramps up and then kicks it out after that. But it'd be nice if we could get an immune response right at the door so the virus never gets in the door in the first place. Future vaccines will probably cover that, but right now we don't have that. And so there's some research going on around trying to answer that question: how long are people going to be contagious if they're vaccinated? And so more to come on that in the coming months.
And I would say that for the pediatric audience, we just literally do not have the data. All the data on this topic is really, for the vast majority, is going to be adult literature. So we will be extrapolating from adults for the time being.
Thank you both. Very last question, then we'll wrap up. Do you recommend people with cold symptoms get tested for COVID?
Absolutely, I would right now, because, especially if you're vaccinated, that may be exactly how COVID-19 presents, as a cold, but even if you're unvaccinated, some people do get, Delta seems to have a little bit more ability to cause a lot of nasal symptoms than previous variants did. And so I think that if you have cold-like symptoms, nasal congestion, sneezing, chest congestion, et cetera, you should get tested for COVID-19. Absolutely, you should, because it might very well be COVID-19.
Yeah, and I think, especially speaking from the pediatric perspective, we are really trying our very hardest to keep children in the classrooms, to disrupt their education and their overall well-being as little as possible. So it's incredibly important that if you have, cold and flu type symptoms, to get tested if you can. Now, the health departments do have concrete guidance to give you, depending on which symptom you're having, whether or not you require testing or not. But I certainly, at a minimum, if you're having new onset respiratory symptoms or fever, to not enter the school building, to take that recommendation very seriously, because again, it could really have a very large effect on the functioning of that classroom and the school if COVID-19 is brought into the classroom, especially in schools where there are not universal masking mandates.
Dr. Rosie Olivero, Dr. Liam Sullivan, thank you so much for your time. We appreciate you. Thank you to all the media who are attending. If you have any follow-up questions, please feel free to reach out to Rick or myself.
Thank you.
Thank you.
Thank you. Have a good day, everybody.
Bye.